Welcome to the International Journal of Paramedicine podcast. I'm Mick Gunderson, the editor-in-chief, and I'm so glad to have Cameron Rimstad, Jasmine Kayanja, Sidney Newman, and Efrem Violato here to talk about a manuscript appearing in number 13, our January-March 2026 issue. It's entitled Bachelor's Degrees as Entry to Practice and Literature Review of Paramedicine and Other Health Professions. Welcome, everyone. So I'd like to open with Efrem. What prompted you and your team to work on this particular topic?
So the impetus for this really came from the program here, the paramedic program at the Northern Alberta Institute of Technology, because in the last year or 2 years, maybe a little longer, there's been a lot of discussion about the potential transition of paramedicine to a degree bachelor's program here in Canada, where currently it's either a PCP 9-month typical program, ACP 2-year, but it doesn't exist within that space. And so this has been ongoing. There's current discussions in Ontario, other provinces as well as here. So the question that the program came to us with is said, well, what's the evidence here? What do we know about this? And so that prompted us to go and take a look. We initially produced a brief white paper for the program and for the college here in Alberta. And from what we saw, we thought that this was a good opportunity to take it, expand on it, make it a full literature review, and disseminate and share those results so that anybody else who's considering this, I won't say problem, but this this issue, here in Canada or in other countries as well, has this to build off of and start to gather some information.
Yeah, the timing of this actually worked out well because, as you're aware, also in issue 13, we published our debate on an associate's degree requirement for paramedics. And while the panelists were from the United States, obviously this has implications for other countries as well. So first of all, thanks for doing this project, and thank you for the timing of your submission. Yeah. This all worked out really well. I'd like to go to Sidney next. Could you tell us a little bit about what process you used to conduct this project?
Yes. So for our initial search, we did kind of a divide and conquer technique where me, Cameron, and Jasmine went separately and searched up, I think it was 4 main databases. After we did our initial search, we kind of came together, got rid of duplicates and anything obvious that had to be cut. And then all of us read all the rest of the papers, and we decided together what we thought would be the best to include in the paper and what did not meet the inclusion criteria, so that when we did write the paper, we were coming to a united decision on how we wanted to present the findings that we found in the literature.
Excellent. So we understand why you did the project. Now we understand how you conducted the project. So Jasmine, what's the bottom line? What did you find?
We found 4 main things. So we divided it into the positive things we found, the negative things we found. And so on the positive side, there were things like improved patient care and improved critical thinking, cognitive skills. And another major thing was more access to career opportunities. And then the 4th major thing was that people had more personal skills, relational skills on the job. And then for the negative side, we found one was lack of accessibility due to mainly the degree being more expensive, being further from where people live. So the costs that come with that. And then also the fact that it's a question of whether or not it's actually necessary, because some people say that an associate's degree or a diploma is sufficient enough education. So, but those were the 2 main things on the negative side we found.
Very good. So I want to direct the next question to you, Cameron. Given we've got the circumstances that prompted the study, we know how the materials and methods worked, and Jasmine has briefed us on the results. What do you feel are the implications of this? What should people take away from this, or so what? Answer the so what question for us.
Sounds good. So during our search, it was very difficult to find any sort of paramedic papers. So we had to draw from other disciplines, primarily nursing and dental hygiene. Jasmine kind of mentioned the patient care benefits. So those are mainly from nursing papers. And if you think about nursing, we have that blend of cognitive and then the clinical like the clinical skill aspect, kind of similar to paramedics, where they got to use their cognitive critical thinking skills on the job and then blend it with those clinical decision making and the skills that they actually have to use to perform those tasks. So using that, we kind of looked at it, whereas in Canada, where we're from, like bachelor's degree, nursing is a bachelor's program. You can get like a lower level program, but it comes with less kind of autonomy. There's less you can do. The salary is much lower. So if you're thinking of, and I would argue that almost the circumstances in paramedics, they deal with more often life or death situation, and they encounter a lot more variety in what they see. So I think that need for those advanced critical thinking skills that come with the bachelor's degree is definitely warranted for sure. I also think that the salary increase coming with the bachelor's degree, when you have the development of your critical thinking, your cognitive skills, the more time you're spending around faculty, the bachelor's degree just offers so much more in-depth knowledge that you can develop while you're in school still, rather than having to learn hands-on on the job as you're going through your career. Now, obviously, we found some limitations. I mean, it's tough for people who are not from a city where many bachelor's degrees are offered in universities and colleges and places like that. So it would force them to have to move away from home, which could incur a higher cost for sure. It's probably a drawback for those people, but we ultimately need people in those rural places too that live there. So, and there's even like the access to resources is probably even less in those rural resources or rural areas. So having that advanced knowledge, having those deeper critical thinking skills and ideas is definitely going to be warranted in a rural area. And when we think about nursing, we had a nice paragraph in ours about evidence-based practice, and you can't really practice evidence-based practice without the understanding and ability to look at a research paper and understand it and critique it, which is obviously not something you're going to get unless you have the statistics courses, the use of it during your education process. So in order to practice evidence-based practice, paramedics would need to have that fundamental understanding of how to look at a research paper, how to critique it, what to draw from it, how to find conclusions from it. So that was another big piece that I think came with our want for more bachelor's degrees. But the issue is, especially it's a particular issue with the transition period, is where are the educators going to come from, right? Because we want a bachelor's degree to educate a bachelor's degree, but if we don't have a bachelor's degree program right now, we can't really develop bachelor's degree paramedics. So there's a kind of a barrier on where those educators are going to come from in terms of how are we going to teach a bachelor's degree from a person who doesn't have one. So that was another kind of barrier we kind of looked at, but ultimately there was a lot more positive in terms of clinical skills and critical thinking skills and cognitive abilities for paramedics. So that was majority of what we found there.
No, great. And that's a great segue to the last question I want to ask. And I'm going to bring this back to Efrem. So to conclude, what are your recommendations or suggestions to those who might be considering this issue from an employment requirement or a regulatory standpoint? Or in other words, what are your thoughts about how to operationalize this?
Mm-hmm. Well, I'm glad that I could just provide my thoughts and not have to be the decision maker on that. But I think there's, a couple primary things to consider. One, current state of the healthcare system. I don't know all the details of various regions in the United States, but here in Canada, basically across the country, healthcare system is in crisis. we don't have enough healthcare professionals. There's major overloads in the ER departments, everything like that. So we want to ask, is if we switch to bachelor's degree, is there going to be a lull in employment in this critical profession, that could potentially be keeping a lot of people out of the hospital, out of their crowded ERs. But on the other hand, if we take them, we train them up to a higher level and ability, as Cameron was discussing, maybe that precludes a lot of those cases that would be transferred. So it's a little bit of a balancing act. And considering it as well from another side, there's a professionalization aspect. And I think as paramedicine, the practice increases in role, scope, everything they can do, if it moves to the level of a bachelor's degree, even thinking from a union perspective and all these things, that increased professionalization will garner more respect for the profession, more resources, and then be better able to serve the public. So I think if you're going to make a decision on it, I'm not going to put it out there, so I'm not on record as saying go one way or the other. But I think that to advance the practice of paramedicine and grow it as a profession, it probably at some point will be necessary to make that movement towards a bachelor's degree, and just the role and scope is going to expand too much for it to be done in a 1 year or less or 2 year program.
No, points well taken. Thanks for sharing that perspective on us. So with that, I'd really like to again thank all of you for this effort to improve care and for taking the time to write it up for publication in the International Journal of Paramedicine. So on behalf of the National EMS Management Association and the entire journal team, thanks for watching and listening.